Welcome to the Kurisko Company podcast. I'm your host, Dr. Lee Kurisko. Our guest today is Dr. Nikki Davis. She's board certified in both family medicine and lifestyle medicine. Dr. Davis attended the University of Utah School of Medicine and did her family medicine residency at the Montana Family Medicine Residency. She's certified with the American College of Lifestyle Medicine and also has certification in the START solution and with the T. Colin Campbell Center for Nutrition Studies with eCornell. Early in her career, she worked as an engineer in the space shuttle program. However, after finding her passion with food to be used to prevent, reverse, and treat chronic disease, she became a medical doctor. She's worked with a number of prominent plant-based physicians, including Dr. John McDougall, Dr. Anthony Lim, Dr. Alan Goldhammer, and Dr. Michael Clapper, amongst others. She's licensed in several U.S. states, and she works with Love.Life Telehealth. Welcome, Dr. Davis. Thanks for doing this for us.
Thank you so much. I so appreciate being on here with you today.
Thank you. You know, you've got a very interesting story, starting as a rocket scientist and then moving into medicine, and primarily motivated by your interest in disease prevention and reversal with plant-based medicine. The only other physician I know that had that sort of a career trajectory is Dr. Joel Fuhrman, who was interested in this before he went to med school. So it's such an intriguing story. Tell us more.
Yeah, it's interesting that you mentioned that because I've had the very fortunate experience to go skiing with Dr. Fuhrman. And we talked about that exact thing, that neither of us has met someone else who specifically went into medicine to practice this type of medicine, lifestyle medicine. So it is a bit of a unique journey. You know, I think most physicians who I've met who are in the lifestyle medicine industry found it through some other way, right? It's a patient who had a really good outcome, and so then they started doing their own research, or they watched a documentary and started digging into the research themselves and finding out what was this all about. So yeah, I worked as a mechanical engineer on the space shuttle program, and I will say I always was really interested in math and science and fixing problems and inventing things as a kid. And so engineering did seem to kind of follow along with that interest, but I was never what I would say really passionate about it. I was good at it, and I really liked the challenge. But it was, you know, when it came down to the day-to-day work of it was something where I dreaded Mondays and I was excited for Friday afternoons, right? And then on my off time, that's when I was really digging into the stuff that I really loved to learn about, which was nutrition, and especially plant-based nutrition and how that could help reverse chronic diseases. I did not know that. And when I started learning about that, I just became so excited about the possibility of not only being able to help people feel better and get better and live better lives, but boy, by doing that, now we're helping the animals, we're helping the environment, we're helping the planet. So it's just a win-win-win. And I just said, I just don't want to be an engineer anymore. And I really want to do something for this movement. At the time, I didn't really know I was going to go back and do more schooling. But when I really looked into it, I thought, you know, I think that I have a unique enough background that I could get into medical school using my prerequisites that I already have with engineering. And I think having kind of some more life experience than I think a lot of people do who are applying for medical school, it might be something that I could actually do. And it turns out, yes, they were looking for people with those kind of unique backgrounds. And I will say that even though, and I know you're a medical doctor as well, correct? So
yes,
I know going from what I would say a cushy 40-hour-a-week job as an engineer, making good money. You know, I had a house, I was, you know, I had a good job and I could have done that for the rest of my life. And then to go back, by the way, with a 6-month-old baby and do medical school and residency. And now it's not 40 hours a week anymore, right? It was a big jump, but I will say I never regretted it for a moment because of the goal that I had in mind, which is to sit here today doing exactly what I'm doing, talking to you. And then, of course, my normal job, which is getting to talk with patients and help them get better. It's extremely rewarding, and I absolutely love what I do.
Were you disappointed when you went to medical school and found that there really wasn't much emphasis on nutrition?
Well, I will say I expected it. So yes, a little bit disappointed, but because I knew that it wasn't really something that was being taught in medical schools, I started finding those kind of opportunities myself. And that's where you mentioned in my bio, I started emailing, Dr. McDougall and Dr. Clapper and Dr. Neil Bernard and saying, hey, how can I work with you guys? Because this is the kind of medicine I want to do. And I'm not getting this kind of training in medical school and residency. So I did have to seek out those opportunities myself.
Yeah, I'm sure you had a very unique perspective. When I went to med school, we did have some nutritional education, probably more than average, but it wasn't really very helpful. It's like, metabolism of vitamin A and stuff like that. There was very little about the relationship to the common lifestyle illnesses that we deal with now. Of course, that was a long time ago. I think Dr. Esselstyn was just starting to do his research around that time. I started med school in 1984. But what was it like working with such impressive plant-based dignitaries? That must have been quite an opportunity.
I mean, I am so grateful that I had the opportunity. I think I didn't know then how impactful it would be. I mean, I knew it was something that I really wanted, but especially now that Dr. McDougall has passed away, it's just wow to have that opportunity to work with him in person and actually sit next to him while he's treating patients and seeing how he treats his patients, getting to try his food and eat that way, and seeing my own health improve because I was starting to incorporate more of the things that he was teaching, like getting rid of those processed vegan foods and
Mhm.
removing a lot of those excess oils and things. It really did improve my own health, even though I knew eating more plant food was better. Once I really understood the breadth of what the diet should look like, that's when I really myself started seeing improvements. But yeah, just getting to work with that caliber of people and who have done such amazing things for the plant-based movement, I mean, just speechless. I just feel really, really lucky that I had that opportunity.
Oh, for sure. Well, particularly Dr. McDougall, he'd been doing it for such a long time, and he was really going against the grain, in the mainstream healthcare system. We were really disappointed when he passed away. We were hoping at some point to have him on the podcast. But speaking of Dr. McDougall, I understand that you are very down on added oils and extra fat in the diet. And I think that there's a little bit of a change in the plant-based movement just in the last while, being a little bit more permissive about adding some oils, particularly olive oil. So, what is your stance on added oils?
Yeah, so the way I look at it, and there's a lot of data out there. There's some data that suggests that, yeah, maybe a little olive oil may be beneficial for the diet. It looks like for the most part, it's when you're comparing to a fat that's maybe not as healthy, like an animal-based fat. But in my mind, I think, olive oil, what is that really? It is a macronutrient that's being taken away from its original source. So if you're taking the olive and you're squeezing it, you're getting that fat out of it, right? Now, an olive in its whole form has fiber and it has water and it has nutrients. And so when you take that oil away from it, you're removing those good parts of the food. And, if somebody could say to me, well, eating a plate full of olives every single day will improve your health a tremendous amount, that seems more understandable than just saying, let's squeeze all the fat out of this food and give you what's, just that and leave everything else. I'm much more about, making sure that we're eating the way that nature intended. And that's usually in the whole food without the processing part of it. And we know that a high fat diet contributes to so many health problems. We all need fat. Absolutely. I'm not saying that fat should be completely stripped from the diet. And actually, if you look at all plant foods, they all have a little bit of fat in them. And there's a reason for that, right? We do need some fat, but we don't need a huge amount of fat. And unfortunately, oil, any kind of oil, is 100% fat with very little nutrition. So if you're looking to lose weight, improve type 2 diabetes that's you're insulin resistant, It's going to be a lot more difficult if you're using oil on a regular basis. So I personally don't promote using oil in the diet. I really prefer people to try to focus on whole plant foods and not a processed version of them.
Yeah, no, I agree. Now, the comeback that many people will give regarding olive oil is, oh, what about all those polyphenols?
Right.
What's your response to that?
They're in the olives, right? And actually, you're going to get more of them in the olives. So why would you
Right.
squeeze out the fat from the olive to get a very small part of that? A lot of those are attached to fiber, and so when you're removing that fat from the olive itself, you're not getting all of that nutrition. So it
Hmm.
doesn't make sense to me to get it from the oil when you could just get it from the original product.
Right. Now, here's a question for you. I mean, people in the plant-based world will talk about fats contributing to insulin resistance, particularly saturated fat, because it gets into the cell, interferes with the function of the insulin receptor, and so on. Are the polyunsaturates an issue in that regard as well?
Well, I think that if you are overdoing it, then absolutely. Because if you think about it, when you are eating a high amount of fat in your diet and your body cannot metabolize that, you're going to put it into storage. And if you continue to keep storing it, storing it, storing it in your body has to find places to put it. And so, it might start putting it under the skin, and then it starts to put it around the organs and even in the organs and inside the cells where it normally shouldn't be, inside the muscle cells. So, really, any kind of excess fat that causes you to have excess weight on your body can lead to insulin resistance, and that's not just saturated fat.
Right, right. Well, we actually just a week ago or so, we got back from one of Rip Esselstyn's retreats in Sedona, and we'd done it about 3 years previous. It was really interesting. I mean, I thought the food was really good, um, and people were starting to feel better right away. We had a chat with one young woman who was pre-diabetic and was wearing a continuous glucose monitor the whole time. And on the third day, she was in the normal range with her blood sugars. So it works incredibly well. Now, one thing that people don't talk about enough, in my opinion, is dietary fiber. What are your thoughts on dietary fiber? Why is it so important?
Well, a lot of reasons. So, now you used to do family medicine, is that right? I
Mhm.
think I
Yeah,
saw that. So,
yeah,
as a family doctor or an internal medicine doctor, a lot of people come to us with constipation. It is rampant, right? And one of the main causes of that is not only not getting enough water, but not getting enough fiber in the diet. So, those two things, right? So, if you're struggling with constipation, that's why when you move toward a plant-based diet or a more plant-forward diet, you automatically start eating more fiber because fiber is found in plants, right? It's not found in animal foods at all. So you need to eat plants to get that fiber. And so the more plants you're eating, the more fiber you're eating, the easier it is to have regular bowel movements. So that's number one. So if you're having constipation problems, focus on getting enough fiber and water. But the other beautiful thing is that, we have this whole microbiome that lives in our bodies, on our bodies, in our bodies. And in order for us to have a really healthy gut bacteria microbiome, we need to be eating fiber that promotes those healthy species of bacteria. And so, eating not only a high fiber diet, but a very diverse fiber diet. So, all plant foods are going to have a slightly different fiber structure. So, every time you eat a different plant food, you're improving that gut microbiome, and your gut will just work better. And those gut microbiome are really important for a lot of different activities in your body. So those are kind of some of the big things I would say as far as fiber goes, is making sure that you're having regular bowel movements and you have a really healthy gut microbiome. A lot of people have symptoms of poor gut health these days.
Well, you know what? The other thing that's really remarkable about fiber is how it has such a profound effect on the health of your whole body. The healthy gut microbiome breaks down the fiber into butyrate, and they can find it in the cerebral spinal fluid in your brain, and it's thought to help the blood-brain barrier and help prevent Alzheimer's disease. So fiber is actually a really big deal. One of my sort of pet peeves is everybody talks about protein. Like if you you go to the internet, everybody's talking about how to get more protein, and nobody says anything about dietary fiber.
Right.
It's just a misallocation of concerns.
I
Just
agree. I agree.
going back to the oils, while I think of it, there's a little bit of diversity of opinion regarding the benefit of adding the long chain omega-3 fatty acids in the form of a supplement if you're on a plant-based diet. What are your thoughts on that?
Yeah, so omega fats are essential, meaning our bodies do not make them. So we do need to get them from outside sources. We need to eat omega fats. And a lot of people think, well, okay, where do you, when, if you ask a random person on the street, where do you get your omega fats from? They'll say, oh, eating fish, right? But fish don't make them either. Fish get them from their diets. And it's usually going to be more algae or green foods. And so I personally try to, I would say this is in general for my practice. I really want people to try to get what they need through their diet, through their lifestyle, before trying to work on supplements. Supplements, it's just not the same. Having your sun exposed to sunshine for your body to make its own vitamin D versus taking a vitamin D supplement, they're not the same thing. So it's better to get it naturally. And same thing with omega fats. I prefer people to try to get it through their diet. For the most part, there are really good sources of omega fats. So, for instance, flax seeds, chia seeds. So I usually will say, hey, if you take in 1 to 2 tablespoons of ground flax or flax meal every day, that gives you a good amount of omega fat so that you don't have to supplement. Now, there is a way to check your omega fat levels. So that is something that you can check to see if what you're doing currently is enough. Is that working for you? Leafy greens have omega fats as well. So there's lots of ways that you can get omega fats through your diet. Now, if you just can't get enough, you're already doing 2 tablespoons of ground flax a day and it's just not increasing your level, then maybe we would discuss something more.
Yeah, no, I think that that's a good approach. I've been back and forth on the idea of taking a marine-based omega-3 supplement. Currently, we're not doing that. But we are eating a lot of greens, put a little bit of flax or chia on our oatmeal. So I think we're probably good. One of my concerns with the supplements is that, you can get rancidification of those oils. I mean, they may have been sitting on a truck in 100-degree weather, turning rancid. So I think it fits with what you're saying is try to get the omega-3s from whole foods.
Yeah.
Um,
And
now,
and that's where with the flax, I think also it's important that if you can buy them whole and grind them yourself fresh, that's best. But you can buy flax meal in a bag. And if you do that, again, that can go rancid too. So I keep mine in the freezer so that it prevents that from happening.
right, right. And now, speaking of sources of fat, what do you think about the inclusion of a small amount of nuts in the diet?
Yeah, so I think it's fine. I think as long as it's a small amount, they can be certainly health promoting. It's when we buy these big jugs of mixed nuts from Costco and eat several handfuls because they're salty and oily and you can't stop yourself that we get into issues. So I think a small amount for most people is just fine. Again, it comes down to just trying to minimize the saturated fat and overall fat in your diet if you are dealing with chronic diseases. And that's what I deal with a lot of is people who have chronic lifestyle related diseases and they are looking to reverse or prevent that. So we work on making sure that their diet is as the best that it possibly can be, and having a small amount of nuts. I think that's very normal to have access to a small amount of nuts and seeds. It's just that unfortunately these days we just have access to so much. You got a big jug of peanut butter. It's so easy to eat half a jar, right? And that I don't think that that's natural at all. So you just have to be really careful that it's always unsalted, no added oil to them. It's just a small amount, maybe a handful or less a day.
Yeah, it's the high calorie dense plant foods that can be a bit of a downfall for me. Like I like peanut butter on Ezekiel bread, and it's easy to overdo it. Or another one of my things that I'll overdo are those medjool dates from Costco. I think they're really good.
Oh, Yeah, dates are so
I find it
good.
hard
Dates are
just to
so
eat a
good.
couple of them.
Yeah, and then you
But it,
add peanut butter to the date.
right, yeah,
Right?
yeah. Well, it was interesting. We were at this Plant Strong retreat, and I was absolutely shocked because I think I eat a pretty good diet, but I lost 3.5 pounds,
Wow.
which just blew me away. Now, maybe it's because I'm letting in more unrecognized sources of sodium in my diet than I'm realizing, and I had a bit of a diuresis. But it was a good experience because, maybe I can dial it in a little bit better than I have. Um,
Yeah.
Plus, it was actually a lot of fun. I can't recommend it enough. Now, do so you work for Love.Life Telehealth, which I think must be amazing because then you can really focus on, the lifestyle issues. Do you work in a conventional medical setting as well?
I do not. No, this is
Oh,
all
you
I
don't?
do. No.
Yeah.
So once I graduated from residency, this is what I've been doing ever since. I mean, and this was the goal, right? I didn't
Mhm.
want to work in a conventional setting. I mean, I wouldn't mind it, but as a resident, I worked for 3 years as a family medicine doctor in a typical clinic setting. And it was tough. I mean, I was in Montana, beef country.
Mhm.
So it was
Right.
tough to find those people who were really interested in making lifestyle change. I did my best over my time, but I will say it's so much more rewarding for me to have people come to me very motivated. They want
Mhm.
the information, they want to make changes, they want to have that accountability, they want to know exactly how to make this lifestyle work for them. And so I get to put that to work every single day that I see my patients. So yeah, that was always the plan. I wanted to do this kind of medicine.
Yeah, I mean, it must be amazing because you're working with a self-selected group of people that are already interested. I feel well. I have some thoughts about primary care. I really believe they just don't deal with root causes of illness enough. As a radiologist, I mean, I just see the consequences of poor lifestyle, like virtually on every scan. Where they have coronary plaque or fatty liver or gallstones or whatever. Um, but I think there's a couple of issues in sort of the conventional medical setting. One is the average doctor really doesn't know much about this at all. And then the other obstacle is, they may only have 10 minutes with the patient. So I do know one young doctor who did the lifestyle medicine program, but of course, she's working in a conventional setting. So the opportunity to converse with people is going to be limited. And the other thing is where we are here in Northwest Iowa, uh, it's not exactly fertile territory for plant-based ideas. I mean, 85% of what they grow around here, like basically, Iowa's just a big farm. 85% of crops are just being fed to animals. So it's deeply ingrained in the culture that that's what you do. You eat animals, and that's kind of the basis of your nutrition. So um, so Joyce and I are 100% plant-based. At this retreat, we met another woman that from Iowa, from Des Moines, that's vegan. So as far as I know, there's only three of us in Iowa. So, but we're doing what we can to try to move the needle. But I guess it's kind of an uphill battle. And then, of course, the other thing is there's little financial incentive for the healthcare system to promote this. I mean, it's actually you're actually going to cut off your supply of customers.
I
Uh,
know.
so there is that conflict of interest, which is so unfortunate. And they call themselves a healthcare system, but the truth is, it's really just disease intervention.
Sick
Um,
care. Yeah.
yeah, it's sick care. I mean, that would be the more honest name for it. Would be sick care. So, anyways, it's a continual source of frustration for Joyce and I to see that this is just the way it is in healthcare. And of course, everybody bemoans, oh, we're spending $4.9 trillion a year. How do we get those costs down? And you can shuffle the deck as much as you want regarding healthcare financing, raising deductibles or whatever, or, whether you go advocate a government system or some sort of reform. The bottom line is we have an incredibly sick population. Um, And that's just not going to change as long as people are eating only 11% of their calories from whole plant foods.
Right.
Um,
Yep.
but anyways, I have to be careful about what I say when I'm at work because most of them just don't get it.
I
Um,
know.
now, soy is something that gets a bad rap. What are your thoughts about soy?
Well, soy is, it's from soybeans. So soybeans, they use soybeans to make a lot of things. I mean, if you think about edamame, that is the soybean, so you can eat it in its whole form. And then if you just very slightly process it, you can make tofu or tempeh, and then you can process it even more where it becomes more ultra processed. And, that's where we see some of those fake meat products that are only like soy protein isolate, where they've just taken away the protein from the soy. Um, there's soy milk that's very minimally processed. So, um, soy, I believe, is very health promoting. I think most people should have that in their diet. Absolutely. We know that women who eat more soy products have less breast cancer and less breast cancer recurrence. I know for me, it's something that is very typical in my diet. We eat a lot of soy, a lot of tofu, especially. I think as long as you're having it in a very minimally processed form, such as soy milk, tofu, or tempeh, or just the soybean, I think that that's absolutely wonderful for the diet.
What do you say to people when they raise concern about the estrogen and it's going to be feminizing?
Well, that is unfortunately a myth that was started that has been debunked. Um, so actually it works opposite to that. You would think that because it has those phytoestrogens that it would work on the estrogen receptors in our bodies, but actually it helps to block those extra estrogen receptors. So it's more beneficial for your diet. That is absolutely a myth.
Yeah, no, I agree. Well, we just watched a short YouTube video the other day about this guy. He was giving a vegan a hard time about his diet and, saying the soy is feminizing and all that estrogen, that sort of thing. Well, the truth is, they'll criticize someone that's eating soy, but meanwhile, they'll be consuming dairy, which doesn't have phytoestrogen in it, it has real estrogen in it. So the likelihood is you're going to be far more feminized from consuming dairy than you are from soy.
Yeah, I never even considered that. That's so true.
Yeah, yeah. And, a very common problem that I see as a general radiologist is gynecomastia. They'll see the doctor, they have some tenderness under their nipple, or, they're noticing that there's some growth there, and they come in to get workup with a mammogram, once in a while an ultrasound. And, I mean, the number of primary male breast cancers I've seen in my career, I could probably count on like two or three fingers. Um, but that's a dietary disease, really. By being overweight, you get that aromatization of your testosterone by your fat. And we work them up, and I give the assurance, well, this is not cancer, and they usually give a big sigh of relief about that. And just recently there was an individual that came in and he says, well, so it's not cancer, is this anything to worry about? Well, I said, well, the truth is it's a sign that you're metabolically unhealthy. And I explained a little bit about that, but whether or not he was going to, I actually recommended Dr. McDougall's starch solution. Explained a bit why, animal products can be a factor in this development, and the other various risk factors for gynecomastia. Whether or not he took it to heart, I don't know. But it's a little bit sad that this is such a common problem. And like so many common problems, you can trace it back to what people are eating. Um, but
Well, and on that same vein, think about erectile dysfunction and how that is really
mhm.
an early indicator of cardiovascular disease. So we're talking about, men not wanting to grow breasts, and they're wanting to be able to function that way. And unfortunately, it's the animal foods, the saturated fat, the dairy products that are making those things worse. I mean,
Mhm.
that's the lead cause of cardiovascular disease, our number one killer. But if you're talking about erectile dysfunction, boy, you've got to get rid of that saturated fat in those animal foods, because that is really what is leading to this plaque formation. We think of plaque buildup in the arteries in our heart, maybe the arteries in our neck, but those same arteries are going all throughout our body, and they are being affected by that same plaque. And it often results in things like erectile dysfunction. And then ultimately, when we see that, we worry about the plaque now that could be in your heart arteries as well.
Yeah. So my understanding, the penile artery is, I think, about 25% the diameter of a typical coronary artery. So it's sort of like the canary in the coal mine. If you develop erectile dysfunction, it's a sign that you're developing heart disease as well.
Right.
Tell us a little bit more, like, what's so interesting when you put people on sort of a whole food, high carbohydrate, low fat, plant-based diet with lots of green vegetables, the men that are being treated for heart disease in this way, their erectile function returns promptly. How does that work? What's going on there?
Yeah, well, it's the same reason that we have seen improvement, right? So there have been studies done that show improvement in angina. So angina is just chest pain from, when you're utilizing, maybe you're exercising and your body needs more oxygen, and so you're pumping more blood. And when it does that, if it's pumping through those arteries that are narrowed and hardened, it can't get the same amount of blood to your heart that it normally can when you're just sitting there. And so then it causes pain, right? And with erectile dysfunction, it's similar in that those arteries are going to have a little bit of plaque in there. They're going to be narrowed a little bit. They're maybe even hardened because of that calcified plaque that's in the walls of the artery. And as you start to eat better, you can actually improve the function of those arteries, where they can become more pliable again. Hopefully you're getting rid of that soft plaque, that inflammation, and that can help those arteries work better as well. And then, of course, you're talking about just what is going through your bloodstream, right? So if we're eating a lot of high fat all the time, you're going to have a really sluggish bloodstream. And lots of fat, if you've seen Game Changers, I'm sure you have, but they show what it looks like after you've had a high fat meal. You've got really thick, fatty blood. And that's hard to move through all those tiny, tiny little capillaries, those tiny arteries. So when you get rid of all that high fat and your blood can really flow through, that also helps. So it's not just, helping the overall health of the artery itself, but it's also what are you putting through that artery?
Yeah. The nitric oxide thing is a big factor that you get from green vegetables. And my understanding is that on the Esselstyn program for people with heart disease, they're eating green vegetables 6 times a day.
Yes.
When we were at RIP's retreat, they had green vegetables 3 times a day. And one of the things that one of our takeaways, even though it was sort of a review and very familiar with the material, is that we eat a lot of vegetables, but it would probably help to eat even more, so we're trying to adhere to that. I just thought of another thing that interferes with sort of sexual function that a lot of people don't know about is, and I see this on CT scans very commonly, with diabetics, the vas deferens will calcify. And that has a function moving the sperm from the seminal vesicles into the urethra, and is part of the whole process of ejaculation and orgasm. I'm sure most people are not aware that that's what happens when you eat a lot of animal products, which of course causes that insulin resistance, it raises your blood sugar, and then you have all these problems.
Absolutely.
Now, do you have any particular success stories in your patients that of people that have really turned things around by cleaning up their diet?
Well, I do. And I will say, because of the patients who come to see me, I mean, I have many, 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 many stories. And I get to tell people, these results are typical. We often see these ads on TV for medications, and it's always saying, or diets, right? The next diet thing. Results are not typical on those. But with the people who I see, if they follow what I'm recommending to them for their lifestyle, it is very typical to see lots of improvements. So honestly, every day that I see patients, I'm seeing improvements. And
Hmm.
so I would say one of the most stark improvements that I saw was a patient who had been living with type 2 diabetes her entire adult life. I want to say she was in her maybe late 30s. Um, and she was using a huge amount of insulin every day, extremely insulin resistant, so insulin resistant that she needed to use especially a higher, what would you say? The amount of insulin in each dose was higher than normal. So it was about 5 times the normal. So it's called U500 because it's just, much more insulin in a smaller amount because of how much she had to take. And it ended up being around 500 units per day.
Sounds
So
like a lot.
it's a lot. I will say, most people maybe use 20 units a day. So if you think about that, I mean, 500 is just, it's way, way more. I mean, when I see someone on 100 units a day, I'm thinking that's a lot. So to have 5 times that amount. And she had already started making some changes, some lifestyle changes. And what was happening is she was starting to have a lot of lows, a lot of low blood sugars. And so she was taking these sugar tabs all the time. I mean, she said, I have to have these with me, and I'm just popping them all the time. And she was working with an endocrinologist, a specialist in diabetes. But because conventional doctors don't really get to see people get well over time, typically you're adding more medications. Sometimes it's hard to see or hard to believe that someone could actually be getting better over time. And so she just wasn't decreasing her medications fast enough. And so what we did was we stripped away a lot of the medication, and she ultimately only needed 20 units per day. So she went from 500 to 20. So she lost a lot of weight. And this was all through just a plant-based diet. So just going from more of
Wow.
a standard American diet to a whole food plant-based diet. And it took her a long time to get there, but boy, did her blood sugars improve pretty quickly to where it was almost becoming dangerous because she was being over medicated.
Now, was she a type 1 or a type 2?
Type 2.
Type 2. So
Mm-hmm.
it's possible that she could end up not needing any insulin at all.
Absolutely. So in people who are strictly type 2, where it really is just insulin resistance, meaning your pancreas is still working really well, it's making plenty of insulin, but your cells just cannot use that insulin appropriately. And so the blood sugar continues to rise in your bloodstream. And so for people like that, whose pancreas is working fine, it is absolutely reversible. And that is something that I see a lot of, not only type 2 diabetes reversal, but prediabetes. So if you catch it quick enough and you say, hey, I don't want to be on all these medications that my doctor has prescribed me, it is reversible. And unfortunately, a lot of doctors will not tell you that. And I think a lot of it isn't that they're trying to hide it from you. It's just that they don't know. This is still kind of something that is a little bit under wraps, that people don't really understand
Yeah.
that this is a preventable and reversible disease.
Yeah, no, I 100% agree. You may have read Mastering Diabetes by Cyrus Kambata and Robbie Barbero, and they cite research going back into the early 20th century where they were improving diabetes with higher carbohydrate intakes. And so, the average doctor does not know anything about what you're talking about, and yet the knowledge has been around for a really long time. So it is kind of an uphill battle. Now, have you had any success working with type ones?
I have. Yeah, I have several patients with type 1 diabetes who have successfully transitioned to a plant forward or plant-based diet and been able to reduce the amount of medication that they're on. So in a type 1 diabetic, they are completely insulin, they need to use insulin. They are insulin dependent. But that doesn't mean that they cannot improve. And so, you may be someone who, say, uses 20 or 30 units per day. And by switching over to a plant-based diet where you can get rid of that insulin resistance, which is kind of almost like a type 2 in addition to type 1. But if you
Yeah.
can get rid of that type 2 part of it, that insulin resistance, then you have a very good chance of reducing the amount of insulin and also having just better control overall, less ups and downs. And so, yeah, I've seen that several times with people with type 1 diabetes.
Yeah, yeah. I mean, I think the mistake that a type 1 diabetic would make is, well, I can eat this food that's not so great. I'll just bump up my insulin. But my understanding the pathophysiology of the sort of accelerated aging of your tissues is enhanced. Even if your blood sugar is low, if it's requiring more insulin, you're still accelerating that aging of your tissues. But the thing that people, in our experience, is they just have such a hard time wrapping their head around that you can improve insulin sensitivity by eating more carbohydrates, more healthy carbohydrates. People just that just makes their head spin. And of course, the average doctor doesn't understand it. I remember having a conversation fairly recently with a doctor talking about the importance of being on a keto diet. So anyways, well,
Right.
having said that, I wanted to ask you, what are your thoughts on, keto and paleo and carnivore diets? I mean, they seem to be very popular. Do you have any thoughts on that?
Well, I do worry about people getting enough fiber, like we talked about, right? I worry about people not getting enough carbohydrate. I mean, carbohydrates, for some reason, it's a dirty word now. Carbs is a dirty word when our body runs on carbohydrate, right? Carbohydrate needs to be broken down into glucose, which is what our body uses to make energy. That is the primary fuel source. That is what your body wants. And only when that is not available does it go seeking something else to try to make energy out of, whether that's fat or protein. So complex carbohydrates. I mean, a donut is different than a potato. Some people will think that a donut is a carb. Actually, if you look at the macronutrients, it's mostly fat. It's very little carbohydrate compared to fat. Whereas a potato is mostly carbohydrate, a little bit of fat, a little bit of protein, right? So I will say that when I talk to my patients about diabetes, I'm having them increase the amount of carbohydrate in their diet, and they are reversing their diabetes by doing that. It's just that those diets, the keto, the paleo, all those, I have a lot of people coming to me saying, I tried this, it is not sustainable for me, I feel horrible. And now I've started Googling, and what is this plant-based thing? I want to try this. This seems like something that's more doable. And it is. It's
Hmm.
much more sustainable for people. It doesn't feel like a diet. Once you get through the hump of making that transition and just changing your lifestyle overall, it becomes second nature and it's wonderful. It tastes good. You feel full. You feel good. You feel healthy. You're getting off the meds, right? It's absolutely worth it. Whereas those other diets just make you feel worse over time and you're just constantly craving, right? Because your body is always wanting that carbohydrate. It's so important to get it. And so that's where I always talk to people about, like you mentioned, the starch solution. That book is excellent
Hmm.
and talks about why we need those starchy foods. That you think about, people who go and run marathons, they carb up for a very specific reason so that they can make energy while they're running. So it's very important to get those complex carbohydrates. And those diets that are based on meat and animal foods, you're not getting the carbohydrates, you're not getting the fiber. You're just going to feel worse. And it's going to affect your health over time.
Yeah, no, I totally agree. I mean, way back when I sort of thought carbs were the problem and tried to avoid them, but it becomes very unpalatable, after a while. But, one thing I tell people when we're talking about a plant-based diet, which is unlike other diets, whether you're talking about carb restrictive diets or calorie restrictive diets, the longer you do the plant-based thing, it gets easier and easier, unlike those other diets. And
Yeah.
uh, it's just the way we eat now. And if we're ever in a situation where we're kind of forced to eat some plant-based food that's not as healthy, we just can't wait to sort of get back to our normal routine. I saw something that you had said. I reviewed a transcript of another interview that you had, and you said something that really jumped out at me, which is that people only need about zero point 0.5 grams per pound of kilogram per kilogram of body weight, zero point 0.5 grams of protein per kilogram of body weight. And I thought that's an unusually low recommendation. Um, how can we get by with so little protein?
Right. Well, so yeah, you don't need as much as you think. A lot of people are really trying to get way more protein than is recommended by the World Health Organization, the CDC. So we've got these recommendations that are out there that are in that realm, the 0.05 to zero point 0.8, or sorry, 0.05 to zero point 0.08 grams per kilogram body weight. And, we need, so it's really getting down to those essential amino acids that we need to be able to build the protein. And that comes from plant foods. And it turns out, like we've talked about, plant foods contain protein. All of them do. In fact, all living things contain protein. So anytime you're eating something that's living, you're getting protein. So that means all plant foods. And plant foods all have protein, fat, they all have carbohydrate, right? They all have fiber, some amount of water. So you're getting everything that you need in those plant foods, and you're certainly getting protein every time that you eat those foods. And there are a lot of really good plant foods that have higher amounts of protein in them. And it turns out that things like beans that are more starchy, so they're more filling, are also higher in protein. So if you can incorporate beans every day, you're getting the benefit of not only feeling more satiated because they're a little bit more starchy, but then you're also getting that extra protein in there as well. It is more simple than you think to get enough protein to sustain life. You don't need extra.
Right. Yeah, no. So now my understanding is the recommended daily intake is 0.8 grams per kilogram of ideal body weight, but that is 2 full standard deviations above the mean requirement. So when you say 0.5, are you sort of going towards what the mean requirement would be?
So my understanding is that is, I don't remember if that is from the World Health Organization or if they increased the recommendation. I don't know if when that transcript was from,
okay.
but that would have been from one of the, the expert panel recommendations.
Yeah, and that's just so much less than most people realize. And in fact, Walter Kempner, who I'm sure you're familiar with, way back in the 30s and 40s or whatever, he was treating people, and it was only something like 25 or 30 grams of protein a day. And he was getting incredible results with his patients with just the trivial intake of protein. And so astonishingly, the diet was based on white rice, fruit, and table sugar, which is like, even like, it just sounds, how could you possibly thrive on a diet like that? And I wouldn't recommend it as being a truly ideal diet, but it was ultra low fat, as low in protein as possible, because he was dealing with renal failure patients. And you would think, these people would be just dying from malnutrition, but they were actually thriving, which is a kind of a mind bender.
Yeah, I know. That's so
Now these
interesting.
GLP-1 agonists, these GLP-1 agonists that are so popular right now, what's your take on the fact that they've been adopted so much?
I mean, I will say I'm not surprised. There's always going to be that kind of quick gimmick of, what can I take to lose weight that doesn't mean I have to give up my standard American diet? That's what it is, right? It's not fixing the problem. So if you say start a GLP-1 and you lose a bunch of weight and then you try to get off of that medication, if you haven't changed your lifestyle, if you haven't changed your diet, you are going to regain that weight again, because it does not fix the root cause of the problem, which ultimately is the lifestyle, it's the diet. So my thought is it's a Band-Aid. Yes, it does work for people to lose weight, but until you get to that root cause and you fix the underlying issue, it's not sustainable over time. And of course, you're taking a medication that has all sorts of side effects and risks associated with it as well. Whereas when you eat a healthy plant-based diet, the risks are getting better and getting off medications and feeling better. I mean, there aren't downsides to it.
Mm-hmm. Yeah, the only downside I can say with a plant-based diet is you've got to eat so much food.
Oh, and you think that's a
Like
downside?
I've always had a big appetite. Well, I've always had a big appetite, and I work out a lot, and sometimes it's just I have a hard time just getting full. I mean, most people would, love to have a problem like that. But there's something I was going to ask you, and it just fell out of my mind. Oh yeah, here's a comment regarding the GLP-1s, and one of the theories on overweight is that people overeat because they're not getting adequate nutrition from their food. Like say if they're eating a lot of processed foods, so their body compels them to keep eating. Then you put a GLP-1 agonist into the mix. My concern is they're going to eat less of this poor food and be even more malnourished. Whereas what I think they should do is adopt a plant-based diet and naturally stimulate GLP-1, which is what plant-based foods do. It seems to me that it would be best to try that before taking a medication that can cause pancreatitis. I was talking to a physician just in the last week where she had seen a case where a person died of GLP-1 induced pancreatitis. So it just seems kind of crazy to be trying to solve that problem with a pill.
I agree.
Now, you briefly touched on, vitamin D supplementation. Now, at our latitude, we're not necessarily getting as much exposure as is ideal. I've had my levels measured in the past and they run a little bit low, but I also have concerns about taking a supplement. And I do take a supplement about 2,000 IUs a day, at least through the non-summer months. But it's still getting it in a non-physiological manner. And in Dr. Greger's book, How Not to Age, he makes mention of the fact that some of the higher doses, like you get over 4,000 international units, are associated with increased fractures.
That's right.
So, you stated the ideal way to get it is sun exposure, but do you recommend vitamin D? And if people are not getting enough sun exposure?
I do. So in people who are not getting enough, and that's absolutely not a way for them to get it, then yeah, I do try to at least get them to take a small dose that just gets them just into the normal range. We don't need to be shooting for, a level of 100. I mean, really normal is 30. We don't really worry about deficiency until you get below 20.
Mhm.
So you don't need to take a lot. I think most people are taking way more than they need because when you go to the store, they sell big doses, right? You see the 5,000 IU versus the 1,000 IU, and you say, well, boy, this is a much better deal. So I'll just take the 5,000 every day. And then we're checking vitamin D, and it's in the 80s or the 90s. It does not need to be that high if you're supplementing. So I would prefer people get out walking, get out in nature, get some sunshine on their skin to try to get enough vitamin D. I mean, a lot of people are staying inside too much. Honestly, you should be outside more. But boy, if you just can't get it that way, then yeah, I think taking a small amount is reasonable. Just knowing that it's just not the same. I mean, the data doesn't really support vitamin D supplementation to improve health outcomes or improve longevity. It just doesn't. So it still makes me nervous if someone's vitamin D is 10. I want them to improve that. But it's a tricky situation. I don't think that there's like a really clear-cut answer.
Well, there's nothing more gratifying than working with somebody and coaching them on their nutrition and they actually get better. Actually, we've covered everything I was hoping to cover. A lot of really condensed information there. You just add to the army of people saying that this is a really good way to go. Well, thanks very much. Perhaps we can do it again sometime.